All right, next on the agenda is our first call to the public. If you'd like to make public comment, there's a slip on the corner of the desk there that you can complete with your name and address. Is there anyone who would like to address the Public Safety and Courts Committee at this time? All right, seeing none, we'll move to agenda item number 4, which is to consider authorizing the prosecutor's office to fill its child support investigator vacancy with an internal promotion and hire a child support legal secretary at salary grade 3, $13.90 an hour to $18.06 per hour, starting at $13.90 to $15.46 to fill the resulting vacancy.
I'll make that motion.
Support.
All in favor say aye.
Aye.
Any
Aye.
opposed? Item number 4 moves to Wednesday night. Item number 5, consider authorizing the Sheriff's Office to sign a 3-year contract with Combined Public Communications at no cost. Inmate phone vendor with Securus Technologies has expired.
I'll make that motion.
Is there support? Tammy Wilson is here from the Sheriff's Department, our jail administrator. You want to give us a little background and tell us what's happening?
I actually gave everybody a copy. It says the news release right there, press release. But that kind of breaks down exactly what the changes are going to be. One of the big changes is that fees for friends and family. In the past, it would cost friends and family like $15 for an inmate to call home. Now, I've been the jail administrator for 19 years. I've received a lot of calls from family, and they would say to tell their loved ones, quit calling me, I can't afford it. This new proposal here for this company, it will be a flat 20 cents. Some people kind of overdo that as well. They'll go onto a site and actually get an out-of-state number, but there's actually a fee attached to that. So this is going to be 20 cents, so it's actually going to save them. Another thing is going to be video visitation. Years ago that we were never able to have it, but now they're saying that we could get this. So that'll be great for the families too. They can do video visitation at home. So.
And this is at no cost, so this is no additional cost to the
No
current
additional
contract
cost.
that we have
Correct.
with Securus Technologies.
Correct. So it's no cost to the county.
If there's going to be video visitation, that means they're going to install video camera and that kind of thing?
It would, what it is like a little kiosk, like a, and it would cost the family just like a phone call. It would cost 20 cents.
Okay.
So.
And all of that's included in the contract?
Absolutely, yep.
All right. Any other questions before we vote? All in favor of moving item number 5 onto Wednesday night committee of the whole, say aye.
Aye.
Any opposed? All right, item 5 moves to tomorrow night. Item number 6, other agenda items. Do any committee members have other agenda items related to public safety and courts to add tonight? Okay, hearing none, we will go to our last call to the public. All right, is there anyone that would like to address the committee? Okay, hearing none, I would move to adjourn the public safety and courts meeting. 5 minutes. The Health and Human Services meeting will start probably in 5 minutes, I would think.
That we will call this meeting of the Health and Human Services Committee to order. Can we please stand and say the pledge?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Our first call to the public. Do I have anyone here that would like to speak? All right, we'll move on then to our first agenda item, number 4. Review the Shiawassee Council on Aging draft 2020 budget and consider the SCOA request for an increase in the levy from its voter-approved operating millage to 0.46 mils. The SCOA voter-approved operating millage is 0.50 mils, of which only 0.43 mils is currently levied.
I'll make the motion.
Second.
All right, do we have anyone here that is going to speak on this? All right, you have the floor.
I just wanted to thank you for letting me come back and visit you again.
Can you state your name, please?
I'm Cynthia Mayhew. I'm the Executive Director of the Shiawassee Council on Aging.
Oh,
Yeah. I did send a prepared budget ahead of time. I hope everybody had a chance to see it. I took this to the Board of Directors in August, the SCOA Board of Directors, and they had made the recommendation that I come forward and ask for the 0.46 mils to continue service as we currently are doing business.
okay, do we have any questions?
I would just point out, I'm a school board member, and if you take a look at the bottom line there, the 2019 and 2020 budgets, you'll notice that this 2020 budget is less, even with the increase to 0.46. And as I learned at our last board meeting in August when we reviewed this, that's because if you go through the other revenue numbers, you'll notice that there is a decrease in some other sources of revenue. So the budget is actually less than it was last year, but in order to maintain that, the 0.46 would absolutely be necessary. So.
It's about a $54,000 difference between the 0.43 and the 0.46. Which you can see even from my Valley Area Agency on Aging grants, that amount has gone down out of that revenue fund as well. And that will fluctuate throughout the year. It'll go up in some areas based on how much funding is available. But we won't know that until in the mid-year, about February, July, I get notification of increases.
Gary, do you?
Yeah, I'm also on the senior board, and I think we can approve that 4.6, it's only $54,000.
All right. Anyone else? Dan?
I obviously, I don't sit on this committee, but I would make a comment, maybe we can discuss this on Wednesday or Thursday also, but according to our audit that was done 2 years ago, or a year ago, we are supposed to be having the discussion of not even having a connection with SCOA anymore. So I'm just bringing that up to everybody as a reminder.
That was the audit piece. Because we are a separate nonprofit agency, they encouraged us to go with our own audit.
Your own audit.
Yes, and we did that, but we still have a contract.
It's bigger than just you guys going with your own audit. Our audit said that we're legally, because, help me out here with this, Jeremy, we're not, something about.
Well, they didn't meet the criteria of being a component unit for the county,
Right.
which meant they had to be out on their own as far as their audit and stuff like that, because they have investments, I think.
Yes, we have
Counties-
investments.
Counties don't have any types of investments or.
And there was discussion with our auditors that, in addition to you guys having your own audit done, but there was discussion that we shouldn't even serve as a pass-through for this.
I think we have.
Yeah, we're still,
Yeah.
the millage is there, just like the
Yeah.
medical care facilities, MSU, the veterans, they got their own name too. We don't tell them to jump on lakes.
so we're
Still
still with.
not what our auditor said.
I think it's statutorily.
You got it mixed up.
I think he was referring to the audit, and then it was separated where they paid for their own audit to the
What
same
about-
audit.
What about then their investments?
Again, that's why they were audited separately.
Pleasantville's got their own investments too. So,
That's a good point in regards to the Valley funding. Because we've always been involved with the county audit, all of our Valley funds go through the county books. And with us now being separated with our audit, I would prefer to see the Valley funds go directly to us since we are the contract
I think
holder.
that was the
Yes,
issue.
yes,
Is that's what needed to stop. We needed to stop being that pass-through of
Yes.
those dollars because we have no.
it would save a lot of confusion
Then
when
are we still the pass-through thing?
yes.
Yes.
Okay, so there we go.
As far as millage
There
dollars,
needs to be a
obviously.
bigger, regardless of how we're voting on for the millage, bring this up because this was brought to us a year ago, 2 years ago, and there needs to be a discussion, a bigger discussion
Mhm.
concerning that issue.
And I'd like to be involved with that discussion if you do end up.
So then you're looking at the 759,380 for your 19 budget at .43, so that 54 approximately increase would bring you to $830,300
Correct,
is what we would be looking at.
yes. Based on the approximation from the tax.
All right, if nobody has anything else, we do have a motion on the floor in a second. All those in favor of moving this along, please say aye. Aye. All those opposed?
Aye.
Okay, motion passes.
Thank
We're all
you.
set? Thank you. Next agenda item, consider the Mental Health Board's request for the Board of Commissioners to make and issue a resolution in opposition to the state of Michigan privatizing certain mental health services currently contracted to the Lake Shore Regional Entity, a prepaid inpatient health plan, PIHP, serving 7 counties on the west side of the state.
So. Support.
All right, Gary, do you want to?
Yeah, I'm on the mental health board, and it's just kind of formality that we're want to keep the money flowing into that instead of privatizing it. So
Yeah, I would agree.
It's not no legal or anything. It's just a resolution that we support it. So they just want the commissioners to support it.
Yeah, Lindsay gave us a very
Yeah.
informative,
I still would like to look at what we signed a year or two ago. It was this exact same thing. I mean, on file, there's already a thing from the commission that stated we want to keep the local,
Yeah.
and we did all this, so I mean, are we just sending another one now for no one to look at, or? I mean, I guess we need to find it in our office, but I don't think we need to keep sending one every year that we.
Well, the state, they get together and they want to change it every year, so that's why we're doing it every year, because you just can't drop it for 1 year and just let it go, so.
This doesn't involve Shiawassee County. This is the Lake Shore Regional Entity is Kent
West
County, Muskegon.
West side.
It doesn't really have.
What's our hope, they're part of it.
But they were the large regional entity that wanted to take things and regionalize them
Yeah, that's
with the state programs
this
instead of
doesn't
having
involve us.
local independent. And
Well, not us personally, but it does the mental health. They're part of that system, so.
Yeah, but this action does not involve them. This is strictly the Lake Shore Regional Entity.
Will there be resolution language in front of us? I mean.
They sent over a draft resolution. I will tell you, it is rough. It's they have a general apprehension that the current employees, they're going to get more state money. First they complain they don't get more state money, then they get more state money, then they don't like that, like Lake Shore Regional, that the state is going to have 8 seats on their 15-member board. Well, the state's pretty much supporting the whole thing. It's not an unreasonable thing in most cases. But they don't like it because they want
more local, but this particular one, the Lakeshore Regional entity, is not anything to do with Shiawassee.
But the fear is from our locals, that if this happens, it starts the domino effect, and, right? And the
Yes,
kids
I
have-
think,
Right, isn't it?
yeah, well, that, they fear that, well, maybe that'll happen here, and they will lose some of the control they have, but at the same time, the funding's coming from the state. So it's like, they want both parts of it, and I guess, Casey, did we put in that draft resolution in their board packets? There's a draft resolution in your board packets that was sent out last week.
Okay.
And if you read that,
I remember seeing it.
you will find that is very roughly worded. It looks like somebody's sat down in a typewriter and banged out a first draft, and it contains complaints about not getting enough funding and things like that that aren't really, they're not factually supported. I do
That
agree.
wasn't completely my understanding when we
Yeah.
listened to Lindsay Hall.
Yeah.
She could not be here this evening because of
Right.
the suicide prevention walk that they co-sponsored. I could certainly reach out to her and have her here tomorrow.
Well, read the resolution that
I
they
did.
put through. Okay.
I-
And like I said,
she's-
grammatically, it's not incorrect.
She's much more articulate in person. I guess I haven't read a lot of what she puts out, but her explanation, and I think Gary would agree, was quite different than.
Sure, but I would just suggest that you remember it reflects a viewpoint. That as opposed to, like some of the things they state as facts. I looked up on the website for the Community Mental Health Association, which is an association of the employees, that have an interest in seeing things maybe stay the way they are. But I would suggest you review it yourselves. Maybe you'll see.
We should sign a name blindly or something.
Well, yeah. And again, we don't really have a dog in this fight.
One of the workshops I went to at the annual
Well, I was
conference was on
looking
mental
at
health
another
funding. And it was somebody from the Community Health Association that was presenting on some of these things. And I have a bunch of notes on it at home. I mean, it's a really complicated issue with how mental health is all funded. And it is a viewpoint. I mean, because it was coming from County Mental Health Association, as I sat there, I thought, he was presenting the state side and their side, and it was obvious that it's from a point, like you said.
Yes.
a point of view.
Remember this, the Shiawassee County on Aging, their board, they can do this resolution themselves and send that to whoever they want to send it to. But I'll tell you, it appears, and I'll double check, but I don't think even the counties that are involved, you're talking some major counties over there, Kent County, Muskegon County, Allegan County, these are big counties. I don't think they're putting, the county commission isn't putting their own in. Yet they reach out, well, if Shiawassee County, why don't you put in and say send this off to the governor, you're against this and all this stuff. And, I don't know, it's up to the board.
All right, well, we'll leave it that I will reach out to Lindsay and see if we can't get her here tomorrow. So we do have a motion on the floor with a second. All those in favor of moving this forward, please signify by stating aye. Aye. All those opposed?
Aye.
All right, that moves along till tomorrow. Item number 6, consider authorizing the health department to contract with Convenient Urgent Care for sexually transmitted infection services in the amount of $60 per visit for 10/1/19 through 9/30/2020, and authorize the health director to sign all necessary documents.
So moved.
Or,
Anything on this, Larry?
Just a renewal of our contract for
Okay.
STIs.
All right. All those in favor of moving this on, please signify by stating aye.
Aye.
Aye. All those opposed? Moves along. Item number 7, consider authorizing the health department to contract with Connie Brown, RD, CLC, for registered dietitian services for the Women, Infants, and Children WIC program in the amount of $32 per hour for a time period of 9/1/19 through 8/30/2020, and authorize the health director to sign all necessary documents.
So moved.
support.
That's gonna be a big savings for us, definitely, without having to have someone in-house with benefits and retirement, and I mean, we're getting somebody with a, no, there you go.
So the last month, I asked for permission to fill the WIC coordinator position. At this time, we determined we don't have a need for a full-time position. We need some dietary services for the WIC program, and we can do it through a contractual relationship and save money. So at this time, we just want to do a contract with a person who actually is a retired WIC coordinator of Saginaw. So we're fortunate to get her, that price. So, but if we do need to go back to full-time in the future, we would entertain it then. So it's a win-win right now.
Okay, sounds good.
Yeah, we wouldn't get anyone for that, with that level of expertise at
No.
that.
All right, all those in favor of moving this along, please signify by stating aye. Aye. All those opposed? Motion carried. Item number 8, consider authorizing the health department to contract with Shiawassee Regional Education Service District for reflective supervision services for the maternal and infant health program in the amount of $2,138 for 7/01 of 19 through 6/30 of 2020, and authorize the health director to sign all necessary documents. I'll support that.
This is counseling services provided to our staff for staff that does the in-home visiting program for the maternal and infant health. Sometimes they see some things that are pretty rough in their line of work. And so it's kind of basically a health, something to bounce it off of. You've seen some rough things, and that provides them services where they're actually getting someone they can talk to rather than just coming back and talking to me about it or something. So
Okay.
it's a renewal of a contract that we already have too, at a reduced rate.
All right, thank you. Anybody else have anything? All right, all those in favor, please signify by stating aye. Aye. All those opposed? Motion carried. Item number 9, consider authorizing the health department to contract with Shiawassee Health and Wellness for social work services in the Durant School District in an amount not to exceed $80,500 for school year 2019 through 2020, and authorize the health director to sign all necessary documents.
So moved. This is a renewal of our contract with the Durant School Wellness Program. We provide a nurse and a counselor, behavioral health specialist in that school district. We've been doing it for 12 or 13 years. Very successful program. Fortunate to be able to maintain providing those services in Durant School District, which is a high-need school district.
So we do it every year, and we maintain, it's not like a grant or anything we lose, right?
Yeah, so we get a grant from
You get a
the
grant.
state to fund it.
We
And
just
then-
automatically get it every year.
Right, I have a nurse on staff that we house there, but we subcontract the counselor services, rather than taking them on as a county employee and paying.
Well, I was just wondering why I know we always do it 1 year at a time, one year. Is there any reason we can't do
Basically,
it?
because you're following the school year and you wanna make sure the funding's gonna be there next year, and the way school funding goes, sometimes it might not be there. Now, it has been there, we would expect that it will continue to be, but we take it one year at a time.
Larry, why is it always Durant? Are there other?
So when the money first became available through the Michigan Primary Care Association, Durant jumped on it with us.
Okay.
And other school districts at the time were not interested. They were going through cuts. They were going through, all right, that's what the school nurses were being cut. We had one in Wausau, we had one in Byron. And they had, I don't remember who the superintendent was before my time, but who was proactive and said, hey, let's try this out and see if we can keep a nurse in here. Durant still has a nurse. So, great deal.
Right. All those in favor of moving this on, please signify by stating aye. Aye. All those opposed? We are good. Item number 10, consider authorizing the health department to contract with Shiawassee Health and Wellness for social work services in the Perry School District in an amount not to exceed $80,500 for 9/1 of 19 through 8/30 of 2020, and authorize the health director to sign all necessary documents.
So moved.
Support.
So this is exciting because this is a new grant, coming from the same pool where we get the grant money, but there's a big push for mental health in schools right now, because if you're seeing happen across the nation, it's high need. And so new money came available, it was appropriated by the legislature, and we reached out to the RESD to help us identify a high need district that needed the mental health services, and they identified Perry, because Perry has gone through some budget cuts where they weren't able to bring on staff like many of the school districts already have. So they were a little bit behind on that, so it was really a nice fit. So we met with Perry, they were very open to it. I mean, we're gonna put a counselor in their school, and we're gonna get the funding, from the Health and Wellness Michigan Primary Care Association. So excited about this new program, new location. I wish we could do it everywhere, but unfortunately, that's just not the case.
All right, sounds good. Anybody have questions for Larry? All right, all those in favor, signify by saying aye.
Aye.
Aye. All those opposed? Motion carried. Thank you, Larry. Item number 11, consider establishing a Peacetime Veterans Fund, PTVF, to extend services to all qualifying indigent military veterans as provided in the Veteran Affairs and Services recently amended policies and procedures. This will be funded from the Veterans Services Fund, Fund 298.
So moved.
Support.
All right, there is information in your packet on this agenda item. I have attended every veterans meeting since January. I am in favor of moving this forward. We've had a lot of discussion about this item, and it's my feeling that this is the best way to serve the veterans in our community and the best use of the dollars that we are collecting from our residents. Mike, do you want to expand on that?
Yes, I can. In July, the Veteran Affairs Committee voted to start a Peacetime Veterans Fund. Right now, there are no services that we can provide as a county to those veterans that served in between the war period. So between Vietnam, Korea, and then Korea up to 2001 when the Iraq War started. It's not their fault that they served when they served honorably, they got out. Hard times then hits us all in some manner or fashion at some point in life. We can't help them, and personally I think that's wrong. Again, they served honorably, it's not their fault. So the committee approved an initial amount of $50,000 that will come out of cash on hand, so it won't come out of the general budget, it won't impact our budget at all. I think we can actually work at a little less, but I don't know what I don't know for this first fiscal year. So we'll be tracking that dollar amount very closely to establish exactly what a price point is for our budget going forward. And then there will need to be a line item created. I got with the finance department. There are several line items that are open through the state, and apparently the state, as you all know, identifies certain line items by title. There are some open that we can identify as a Peacetime Veterans Fund specifically. I've also done some research with other counties throughout Michigan. Legally, they can't use PA 214 because of the wartime clause. So the only way that they can fund and assist peacetime veterans through their operational fund or from outside funding. And this would be through our operational fund, which we just got reapproved, last year I believe it was. For that, it was originally established in 2014. On top of that, I did reach out to Bonnie Toski, since she was our general counsel, and I did get a legal review from that, and they laid out very nicely in all the state statutes in how that applies, that legally being able to do this, and that's been provided very well in your packets also. It was not a unanimous vote with the committee. I'll tell you, it was a 5-2 vote, so there is still some concern even within our own committee. So That's all I have pending your questions.
Could you discuss a little bit about what the apprehensions were from some of the no-votes? What was the apprehension?
Some of the apprehensions were more of a legal matter of the interpretation of some legal documents that has come out of Monty Hosky's office in the past, specifically 2014, that did not address some do's and don'ts with the operational fund, and so there's some concern on that. I originally reached out to the Attorney General's office, and because our department is not a state entity, we cannot engage or utilize the legal review or opinions of the Attorney General. We'd have to send it to a state legislature. They in turn would then have to request a formal investigation, and then I believe the state police would have to assign an investigator to then figure it out to present a case to the Attorney General's office. So they said if you have a general counsel, which they know Monty Hosky and that firm utilize them. I also spoke with Mike. He also directed me towards Monty Hosky. So we've got a April 15th, 2019 review that supersede. I say supersede. Some of the questions, specific questions were asked in 2014. Specific questions were asked in 2019. 14 does not address what 19 does because the questions weren't asked. By everything, and again, I'm not an attorney, so I can only go with the legalities that I'm presented with. Everything is above board of what we want to do and how we want to do it. Again, however, there are two committee members that have some reservations, and so they voted no for this. So,
But they were not necessarily not in favor of helping the peacetime veterans, but more the legality of it.
correct.
How many other counties do this?
Of that I checked, 6 of the 64 that have veteran service offices in them, I did not check all that. So only going with what the amount that I checked, there were 6.
Madam Chair, can I ask a question?
Yes.
Okay, so just, I don't mean to beat a dead horse here, but
No.
when you talk about seeking an Attorney General's opinion, is this in the purpose of this agenda item, or is this going back to the 2014 stuff?
The agenda item, to make sure that we were legal in one, creating a peacetime veterans fund, 2, utilizing, because we can't use PA 214
Right,
funding because
right.
of the wartime clause. How do we go about that? And because there's already a veteran service fund created in other counties, have it set, I can't say set the standard because it's kind of a fluid
Right.
situation, but they've utilized that specific fund in the past to fund their own peacetime veteran fund, and it's worked.
And currently, there is no Attorney General's opinion on this agenda item,
Correct,
either for us, obviously, or another county.
correct.
So, could we, at the same time, should we make a request then to Representative Frederick or Senator Barrett to get one of those going? Just to make
we
sure,
can.
or we
Yeah.
not do that, and we just, Mike, what your thoughts?
I don't think you need to. A fair reading of the act permits this, as has been done before. It's different than Act 214. And you are probably well aware of the people on the commission have had long-standing feelings that Act 214 shouldn't even be used for salaries.
We've had a court case here, we've had Attorney General's opinions and everything.
Yes,
So-
And because of that is also why I sought out, and I was asked by the committee to go to the Attorney General and get their opinion. But however, is I didn't know that a county government
The legislator is the only,
Yeah.
they're the only
So,
entity that can request.
I
it.
was educated on that as well. But I did, again, I talked to Mike, and then he appointed us, or the office, to our general counsel, which is Monty Hosky.
yes, and I'll add one more thing. When you do that, if you have things, let's say down the road, they decide, oh, you can't do that. In these cases, when you have relied on an objective legal opinion from your counsel, then you don't, there's no retribution.
Right,
They
right.
just change, they just change,
So we would just have to revert back to the original.
Yes, I don't think that's gonna be a problem. I think they're well within this. And bear in mind, when they talk peacetime veterans, they're no different than veterans in wartime who don't get sent to the battlefront.
Yeah, and
They
there's-
really just do the same things, and they're always at risk of being sent there if something happens, so it's not really a big.
And there's still gonna be criteria, and again, I took kind of a sampling of what all the other counties do. There's a 24-month service that you have to fulfill, or your first term of service, and you still have to have either an honorable or under honorable condition characterization of discharge. We still cannot help individuals that have received an other than honorable or dishonorable discharge. And unfortunately, we've got several, we've got one right now that we're going to be sending a packet forward to the Military Review Board to try to change due to some legalities that have come out over the years based upon the incident that affected this veteran. So it's not, we're just going to open our hand and say, hey, here's a pot of free chicken for any peacetime veteran. There's still going to be requirements that that individual has to meet, both by state statute and by what was written from our legal counsel.
I'm just wondering if we should be proactive and have the representative of the senator start the paperwork and just start the process. So it isn't 5 years from now we're still hearing about this. So we can have it, we can be done and over with, because.
I agree with Mike. I don't think it's necessary. I think it would be a huge burden. That was just not, I reviewed this.
Oh, I know, but the
thoroughly.
burden for the next 5 years of hearing about not having an attorney general's opinion on this is gonna.
You can't get an attorney general's opinion directly.
No, you asked for a representative or senator.
Question. So, could we be sued by a veteran who applies for this peacetime and say, well, I'm a peacetime veteran, but you put in the clause that because I was dishonorably discharged, I'm not qualified?
No, because I've
That
mirrored.
clause was there.
That is already.
Oh, yeah, this isn't gonna apply, this doesn't apply dishonorably.
So that's not like us just subjectively saying, oh, we're gonna serve these guys, but not these guys.
No, this is I mirrored this exactly off of PA 214 and tried to make it as, I guess, copycattable, if you will, with the language and the legalities. So it's basically, we're just copying 214, moving it over and calling it something else.
Okay, so based on the 6 other counties that you did see, is this basically what they do?
Correct.
Exactly. So if this was an issue, they were, how many years have they been doing that?
Macomb County in particular is 10 years that they've
10
been.
years on, we haven't had problems. You said 50,000?
Correct.
So how much right now do we have in the fund where we're serving wartime veterans?
Right now, cash account is $233,462 and 23 cents.
So we take 50 out of that, move it over here.
Correct. And then
How
that-
much do we generally spend? And I should have saw this in there, like I said, on wartime veterans. So are we, by moving this 50 over here, are we gonna be not being able to serve as many as we currently do?
No, because it's two different funds. You're talking 214 is wartime funds, and this is operational funds.
14 wartime.
Yeah.
Okay.
Now, is this gonna have to be budgeted because the salaries, the insurance, the dental, all comes out of this pot of money? Yes. So it is gonna have to be tracked and managed.
So what did we decide 50, who was the one who decided 50,000?
The committee came up with that number.
Is an objective number?
I think they just kind of threw it out.
I think it's the number that they want to transfer, and then they'll see where the costs go. They may ask for a budget amendment to maybe
Do
transfer
you feel
more, or
comfortable with
next year not as much.
50,000 is gonna break the bank, you have it? and
No,
then
it's not an issue, no. And I don't think we're gonna hit the 50,000 mark. I think it's gonna be under 30 personally from just the data points that I've looked at over the last year and a half. I don't see us, and the reason is we don't see a lot of the peacetime veterans. However, once word gets out that we're able to help peacetime veterans and other agencies start referring, that number is gonna go up, which means then that the packets and the requests are gonna increase, so. But I'm guessing probably mid to low 20s this first year. So I really don't see it hit 50.
And again, this has been discussed at length, month after month, and we have really looked at it from all angles, and I do feel confident that this is the best way we can serve our veterans with the dollars that we are stewards of.
Yeah, I like you all, but I'm not going to jail for anyone, so if anything looks a little hinky, I will be the first one to raise my hand, put on the brakes, and come to you all for either a special meeting or first, obviously, contact my committee and say, hey, we've got a situation brewing, we gotta relook at what we're doing, so. Yeah.
All right, are we here?
Yeah, I support the fund in the sense of the county's been doing it for 10 years. I think we could legal death, all those things. So let's go for it and move on.
All right, is that the consensus then? All right, all those in favor of moving this forward signify by stating aye. Aye. All those opposed? And we are good. Do we have any other agenda items to come before this committee? All right, hearing none, we will go to our second and final call to the public. Anyone? All right, going once, going twice. We are adjourned.